This is the stuff that will not be discussed the first, the second, or the third time that you go to complain about something to the doctor. What are the other reasons that you could be having discomfort down there besides like the typical like infection stuff? Hi, I'm your local OBGYN. I love women, and I actually hear about this not terribly infrequently. So when we talk about vulvar discomfort, it is not just a yeast infection or BV that's like the very top of the list. There's so many other things that could be causing this. All right, some big trigger things that can certainly happen are number one, vulvodynia, like pain down there, and whether it's muscle tension, nerve tension, some of it's psychosomatic, meaning like from your brain, just sort of like putting that area on fire. Secondly, if you've had a baby, like ever, you can have repairs and stitches and things down there that are part of the scar tissue that make things either hypersensitive or almost like have tied a nerve into like a little knot that becomes extra uncomfortable overall. You can have things that are just muscle or nerve spasm down there. I used to call it broken vagina syndrome, and it's truly musculoskeletal and pelvic floor PT. Chef's kiss on that one. But there are other things that can be culprits, all right? We have bones, nerves, tissue, tendons, hormones, all these other organs that are really not terribly tied to the structures that they live in. They can certainly be the problem. And it may not even truly be gynecologic. So what you may think is vagina pain could be something from your bowels going through something called an inguinal canal down there and setting things ablaze and uncomfortable. So what you need to do is you go through the normal motions, you get your normal checkups, but then you have to start saying, okay, it's not X, Y, or Z, like infection, BV, like a sore that you can see obviously. So let's start digging deeper and like casting the net a little bit wider. Because there's still something that is the cause of what you feel that probably can be identified if somebody digs deep enough.